Good day, doctor. Myself, Pulnata Stefanana. I am an IS clerk. I will be doing the EI examination today. So, are you okay with it?
Yes.
Can I know your name?
My name is Rose.
Can I know your age?
I'm 25.
So, can I ask a few questions?
Yeah.
Do you have any hearing loss?
No.
Do you have any ear pain or ear discharge?
No.
Do you have any previous ear surgery?
No.
Next, I will be doing the inspection. So, I will be inspecting the auricle and the surrounding tissue for any deformities, lumps or skin lesion. So, I will be doing the same on the other ear also. Now, I will be doing the palpation. So, I will be palpating the ear for ear to know if the patient has any ear pain or discharge or inflammation. So, I will be pulling the auricle up and down and pressing the tragus firmly and also pressing firmly again at the back of the ear. Did you feel any pain or tenderness?
No.
So while doing inspection, there was no deformity or skin lumps or lesions, and while doing the palpation, there was no pain and discharge. So now I will be performing the otoscopy using an otoscope with a large speculum. Now I will be sanitizing the otoscope. So now I will be checking the light source and then I will be pulling the ear upward, backward and away from the ear to get a clear view of the ear canal. Now I will be gently inserting the otoscope. Are you okay with it?
Yeah.
So can you stay still and just tilt your head sideways? Okay. Now I will be checking for the ear canal for any redness of the skin, any foreign body or any discharge or inflammation. And next I will be inspecting the eardrum and looking for the cone of light and also the color and contour of the eardrum. And I will be doing the same for the other ear also. Now I will be examining the left ear using my left hand. So I will be doing the same, pulling the ear upward and backward and away from the ear and looking for the ear canal if there is any discharge or any inflammation or redness of the skin, and also looking for the eardrum for its color and contour and also looking for the cone of light. So all the findings are normal. So thank you for your cooperation. Thank you.
Good afternoon. My name is Pius Jacob and I am here to do Weber and Rene test. So first we will be doing Weber test. What's your name?
Stefan,
What's your age?
24.
So first we will be doing Weber test. I'll be placing a tuning fork of 512 Hz. I'll be placing it on your head. If the sound lateral, please let me know sound is heard better in which ear or the sound is heard equally in both ears. It is heard both ears. So that is a normal finding if the sound is lateralizing equally to the both ears. Next, I'll be performing a Rene test in which I'll be placing the tuning fork first on the mastoid bone, and once the vibration stops, I'll be placing it on the side of her ear. So I'll be striking a tuning fork and placing. Please let me know when the sound stops. Are you able to hear the sound? Okay, so if in conductive hearing loss, the bone conduction will be more than the air conduction, and in sensorineural hearing loss, the air conduction will be more than bone conduction. In this case, it is normal. Thank you, doctor.
Good day, doctor. My name is Pulikotal Rosemary Raj. I am an IAS clerk. Today I am going to do examination of the nose. So may I know your name?
Stephanie,
Your age, please?
24.
So have you had any nasal surgeries before? Do you feel like any nasal congestion? Do you feel like any discharges coming from your nose?
No.
So today I'll be doing the examination of your nose. Are you okay with that? So first I'll be inspecting the anterior and inferior surface of the nose. I'll be looking for any deformities or abnormalities. So there are no deformities like saddle or hump nose and it is symmetrical. Next I'll be doing palpation of the nose. I'll be touching your nose. Are you okay with that? So first I'll be checking for any tenderness or pain. Did you feel any pain or tenderness? No. Okay, so there is no pain or tenderness. Next I'll be inspecting using otoscope as the light source. So I'll be inspecting for the nasal vestibule to see if there is any inflammation, any swelling or any bleeding. So it seems normal. Next, I'll be looking for nasal obstruction. So I'll be closing one side of your nose, breathe through the other. Okay, so there is no nasal obstruction. Next, I'll be doing inspection using an otoscope of the largest speculum. So here, first I'll be inspecting the nasal mucosa. The nasal mucosa is pink in color. There is no redness, swelling or any exudates present. Next, I'll be checking the nasal septum to see if there is any perforation or deviation. There is no perforation or deviation of the nasal septum. And there are no abnormalities like polyps or ulcer. Everything seems normal. Thank you for your cooperation. Thank you, doctor.
I'm Patukmar Vivin, I'm an intern. I'll be examining your oral cavities. Okay with you? Yeah. First, I'll be inspecting the lips. There are no crack or swelling or lesions, and the moisture and the color of the lip is normal. Then I'll be inspecting the gingiva. There is no bleeding or ulcerations in the gingiva. It looks normal. Next, I'll be inspecting the mucosa. Can you open your mouth? I'll be inspecting the teeth as well. Can you open your mouth? The mucosa looks normal, and there is no ulcerations or swellings, and the teeth is normal. There is no cavity. Next, I will be inspecting your tongue. Can you protrude your tongue? Can you move your tongue left and right? Can you move your tongue upwards? There is no swellings or lesions in the tongue. Now I will be inspecting your pharynx. Can you open your mouth? The uvula and the tonsillar pillars and the tonsil looks normal, and there is no exudations or swellings. Thank you.
Hello, I am Piyada Shakil Ahmed. I will examine your trachea and thyroid gland. Are you comfortable with that?
Yes.
Now I am going to inspect your trachea. For that you just nip back your neck. There is no deviation from the midline. Now I am going to palpate the trachea. The space in both sides are symmetrical. I am going to inspect the thyroid gland. For that you just extend neck your back. Using the tangential light, I will check the region below the cricoid cartilage for counter side of the gland. The shadow. You to check the patient's swallowing. For that, you extend your neck and swallow and drink water. Extend. I watch moving upward of the thyroid gland. Thyroid gland is symmetry and no contour. Also notice the thyroid cartilage, cricoid cartilage and thyroid gland rising upward with swallowing and then fall back in normal position. Now I am going to start the palpation of thyroid gland. Are you comfortable with that?
Yes.
For palpation of the thyroid gland, you just back your neck and swallow a drink of water. Swallow. I feel the moving upward of the thyroid isthmus, and now I displace the thyroid by my left hand to right and palpate the lateral margin of the right lobe in between the displaced trachea and relax sternocleidomastoid muscle and find the lateral margin. Similarly, I displace the trachea by my right hand and palpating the in between displaced trachea and relax sternocleidomastoid muscle of the left lobe to find the lateral. Gland size, shape and consistency is normal. There is no tenderness. If the thyroid gland is enlarged, then there will be a fluid in the lateral margin. There is no fluid, so thyroid gland is normal, no enlargement. Thank you for your cooperation. Your trachea and thyroid glands finding are normal.
Prakash Santosh Raja, fourth year medical student. Now I'm going to do the lymph node examination. What's your name?
Prince Video.
Now I'm going to the lymph node examination. Is it okay for you?
Yes.
First is preauricular, postauricular, submandibular, submental, posterior cervical, superficial cervical, now deep cervical, then supractal alveolar, finally the occipital node. The lymph node is not swollen or inflamed, so it's normal. Thank you.